So welcome everybody. I am the last presentation and I will be discussing the top findings at site visits. My name is Marie Martinez and I am the VFC coordinator for the immunization program. Um, and if you have any questions, please feel free to put those in the chat or come off mute and ask as we go, because I'll be clicking through some of these slides pretty fast. I know some of the information has been covered, thankfully, by Nick. Okay, so for your site visit, what you can expect is that it will occur every 1.5 to 2 years, and it only lasts about 2 to 3 hours. So what's going to happen is the site visitor in your area will reach out to you via email, and they'll ask you to schedule a date and time. And so they'll give you a list of date and times that you can choose from. And if those don't work, you can email back and forth. And once the date and time is set, they will email you a second email, a confirmation email that will say the date and time. And there will be a checklist in that email. And that will cover everything that they're going to review. So if you have any questions, reach out to your site visitor about the checklist. If the date for some reason no longer works because there's an emergency, just let them know as soon as possible so they can reschedule. And one thing I'd like to emphasize, because this has been confused in the past, is they will be reviewing 10 patient charts that they will choose at random from Alert. So you don't have, that's not something that you'll have to put together for them. So this is a list of findings that we frequently see, and I group them together by documentation, storage and handling, temp logs, the information sheets, and Alert. So we'll go into documentation. So some of the common things that I see are the emergency backup plan hasn't been updated. The vaccine management guide wasn't reviewed annually. Another documentation issue is Alert. Either the primary coordinator or the backup coordinator wasn't updated in Alert. Sometimes the delivery or the address or times have changed, and those haven't been updated. So keep in mind when those things, it's like, when you're changing your phone number, you have to go through all of the different providers that you constantly talk to change those, and Alert is one of those things. And then the different requirements for patient charts, the documentation for those patient charts. So this is the current picture on the vaccine management guide, and we're working on updating that guide. And when we do, we'll send that all out, but the picture on the front will change. So this is a really good source of information. In that guide, it has a VFC task list, and that's broken down by time frame. So one good thing to do would be to look through the task list and the things that you don't normally think about or you don't normally do. It would be good to put those into your schedule or calendar. One good tip is to make sure that you're checking your inventory monthly. And we liked, it's probably a better idea to be doing that more than monthly, but at the very least, depending on the clinic size, at least every month. And I'll go into these off and on, and Nick discussed these. A good way to do that is to not only physically do the check, but to also look at the ad hoc report and the transaction report to make sure that you can tell where all that inventory is going. These are some of the annual things that are good to put in your calendar or your schedule. At the top is the VFC recertification, and that happens at the beginning of the year. It happened a little late this year. And then another thing is to review and update the vaccine management guide. So we see this is a really easy thing to miss, and we see that quite often. And here is the page on page 22 of the vaccine management guide. This is the where you would review it and sign. And Nick discussed these. These are the personal trainings. So a lot of times people will take the training and then they don't have the documentation. whether it's a certificate or a screenshot that they're printed, any way that you can show that the site visitor that you have completed the necessary trainings. And keep in mind who is required to take those trainings. So the annual one is the VFC primary and backup coordinators, but the one that's required every 2 years is only, or at least 2 immunization staff. So it doesn't have to be the primary backup for the vaccine management course. And this can get confusing, so we're trying to make sure that it's clear who has to do what. Now, in order to update your information, your contact information in Alert, if you go to the Alert IS tip sheets, and I have the reference in the end of my slides, at the top right below troubleshooting, you'll see you'll have the manage account or manage access account information. So on that link right here at the bottom, you'll have the tip sheet to show you how to go into Alert and change your contact information. It can get complicated if you don't do it as often, and the tip sheet is very helpful in helping you remember. So the patient record reviews. So these are the things that I highlight in red are the most common errors that we see that aren't in the documentation in the patient records. So the address of the clinic is something that's missing a lot. The title of the person administrating the vaccine. And that's especially true if you have new personnel. And then the date and when the VIS or IS was given, or the publication date. So those are the ones that we see pop up the most, where when we look at the patient charts, the site visitors see those 3 that kind of pop up the most often for not being in the patient chart. Moving on to storage and handling. So we'll go over the units, the outlets and stickers, the emergency plan, and temp logs. So these are all the necessary components for vaccine storage and handling, and we'll go through. There are some, sorry, there's something in the chat from Irma. There are some clinics where it can be difficult to find the clinic name in the EHR. It's not always intuitive to find it on the chart. So, and it depends on the EHR. It's all of these are federal requirements, so I'm not quite sure why they're not in all of the EHRs, because they are required. So you would think that this wouldn't be something that is a concern, and they would have something for all of those requirements. But the VIS, IIS is something that pops up quite a bit. And so sometimes we have to have the clinics just put that information in the notes section. So why is a sticker necessary? So that you don't have somebody walking along wanting to plug in their cell phone because it's low on charge, and then they unplug all of your units, and you end up with a bunch of spoiled vaccines. So the stickers on the outlets is something that they're going to look for. And I believe they have them with them on the site visit if those aren't, if somebody doesn't have those. So what happens when the lights go out? So this is something that happened for quite a few sites this year in January with the ice storm. And you have to have some sort of emergency plan. So in the vaccine management guide, there is a outline, a template for an emergency plan. You don't have to use this particular template. You can make up your own and put it with your management guide. But it gives you a good reference for what you might need. Make sure that the plan is ready to go, that people know where it is, and that it's easy to understand. Because it's not necessarily going to be the VFC coordinator, the person who wrote the plan, that's going to be following it. It could be somebody, like the only person that's at the site. And the guide starts on page 18 and 19. Make sure that you have key details like phone numbers, any codes you might have, the location of things like the backup digital data logger. And then here's a picture of what an emergency transport packout will look at. They will look to make sure, the site visitors will look to make sure that you have an emergency transport packup with the materials. It doesn't have to be anything fancy. It can just be like in this picture, the styrofoam container. Onto the units themselves. So one of the things they'll be looking at is going through all of the vaccines, looking for any vaccine that's been expired, making sure that everything is as it should be, that DDL is placed where it should be, the probe and all the vaccine has been labeled. So we'll play, this is what Chris was talking about, good or bad. I thought this would be a much more entertaining way to ask you about or talk about units rather than spending a lot of time going through this very fine printed piece of or picture, sorry. So good or bad, and please put your answer in the chat. Is this unit good or bad? Irma thinks good. We have some bads. More bads. Bad with a question mark. Chris says good. More bad. So this is both good and bad. So everybody is right with this one. It's good in that you have the centrally placed probe in the picture. You have separated baskets, enough airflow, but there's no labeling, and it's close to becoming overcrowded. So go on to the next one. Is this fridge good or bad? Lots of bads. Irma says bad, too crowded. Is bad. It is way too full. You're right. It's too crowded. Although they do have some labeling in here, but you're getting way too full with this fridge. Is a dorm style unit good or bad? Angelica says terrible. Lots of bad, all caps, exclamation points. So I apologize for the animation. I'm trying to make sure people stay awake for this. It is very bad. So a lab grade unit, is that good or bad? Good. We finally got some goods, lots of goods. Great. It is good. So although they have no vaccine in here, so I don't know how useful it is. Is this fridge good or bad? Or freezer, rather? I'm not sure LOL is good or bad, but it looking at this picture, I would venture to guess that Angelica thinks it looks really terrible. Irma knows that this is bad. Oh no. I hope nobody's freezer does look like this, although I've seen it. So this is very bad. And of course, there's this one bad or bad. Every time I see this picture, I think, I don't know. And I was assured that this was actually somebody's unit. So one of our colleagues had this when he went on an inspection, or on a site visit. Household unit, are they good or bad? We have one bad, depends. Chris might remember something. Good for food, bad for vaccine, only is okay. Good only for fridge. Angelica, you were right. The fridge is good. You can still use the fridge component of a household unit. If you can, some people can be grandfathered in and still use the freezer unit as long as it's still functioning, but newly enrolled sites cannot use the freezer on a household unit. All right, so we'll have another game shortly, but we'll move on to the full suite of ACIP recommended immunizations. So one thing I wanted to emphasize is that this is for your patient population. So when the site visitors come, they're going to expect all the ACIP recommended immunizations for your patient population. We have specialty clinics, like I know Multnomah County has a STD clinic, so we're not going to expect them to carry the full suite. We would expect them to carry for their patient population, right? And so especially now we've started the seasonal immunizations, so they'll be looking for flu and COVID and RSV, if those are in your patient population, specifically RSV. So one of the good things that Nick noted was that this is for the VAP, Vaccine Access Program, or public clinics, and you guys only have to carry 2 vaccines in private stock. You have varicella and flu, unless you want to carry, like Nick said, MMRV and Pfizer COVID. So the private clinics have to carry a full suite of state supplied and private stock. So you guys don't have that extra burden. So that's very good. But the one thing that when you do have your inventory and alert, make sure that you're accurately managing inventory, and that includes putting the private stock in alert on time before staff start to use the stock, because we see that often is that things, the vaccine arrives, they put it in the fridge, and then people start to use it before it's entered in alert. And then, like Nick was talking about, your accountability goes down because alert doesn't have those lots in stock in alert. And then make sure you're accepting transfers in alert, because we see that quite often as well, as the transfer is not accepted. And then when the site visitors come, they'll have you accept the transfers, and then you have to adjust. So this will be the second part of, we'll have a game for this one as well for temperature logs, can be a bit dry. So there's a thermometer guide that we have online, but the thermometer requirements are to have 1 digital data logger for every unit, that is calibrated at least every 2 years, and has a buffered probe, that it can display the min and max temperature since the last check of the thermometer. And then you only need 1 backup logger per clinic with a certificate of calibration. And what we see most often, so when the site visitors go to your clinic, they're going to be looking for a DDL for each unit, and that you have a certificate of calibration, and the backup also has a certificate of calibration. So this is what we see most often, is that the certificate of calibration is out of date. And that's another thing that you can add to your schedule or calendar a few months before the calibration expires, is to go ahead and put a reminder in your schedule to send those out to get calibrated. So we have the digital data logger that you download weekly here towards the bottom, but then you also have the requirement of a handwritten daily min-max log, your temperature log. And there's the link for the temperature log sheets. Make sure you get the right one. We've had some site use a fridge instead of the freezer log sheet, or they use either Fahrenheit when they're recording in Celsius. Thank you, Nick. Yeah, if you're using an ultra cold, sorry, I can say that, there wouldn't be a buffered probe. And logs should be kept at a minimum of 3 years or longer, depending on your own clinic's policy. So at least 3 years. And this is what our, when you download from our website, this is what the temp log looks like. So why do we need both? It seems like a lot of hassle to do both. So there are several reasons, one of which is that all the requirements that the CDC has, it makes it easier if we split it up into having a daily written log and then your weekly digital data logger upload. But another thing that we find is when we go to the clinics, they can't find some of the data. So a lot of what usually gets lost is that weekly upload of the digital data log. So sometimes we've seen a clinic that changed computers and the old files were not brought over to the new computer, or they don't have access to where it is, where it's stored. They don't know where it's stored on the computer. So there's been quite a few reasons why accessing that the data logger information isn't accessible. And the other reason is it activates a daily check. Okay, for this is, I wanted to make sure we went over what's required of the actual daily log. So you fill it out every day that there are clinic staff present. So if you just have admin staff like on Mondays, then you wouldn't expect the admin staff to fill this out. So it would just be when clinic staff are present and can check. So they're going to write down their initials, the exact time they checked it, and the min and max temp. So down here on the bottom where it says current temp, you'll see optional, well, it's part of optional word there. You can record the actual, the current temp, or you don't have to. That's optional. Okay, so we have our last game, name that temp log error, with Betty White, who was great at doing all of these game shows. So with these, with this temp log, what is the error? Can you find it? Amanda says same time every day. It's great. It is the same time every day. So it's very unlikely that you're gonna check the fridge or freezer the same time every single day. So this is something that the site visitor is going to look at when they look at your temp logs. The next one, you find the error in this temp log. We only have one guess, but it is the right guess. Good job. It is the min-max is the same every single day for this week over here, 8th through the 11th. And it's likely that they did not reset the min-max temp. So they just keep getting the same reading because it wasn't reset. So that's one thing. That's the most common problem with the temp logs is the min-max was not reset. All right, what is the error on this log? Or the problem with this log? All right, good job. It is the 10.6. It is too high. And you find the problems with this temp log. See an 8. Remember, this is freezer. Yes, the 8 and the 5.1s are too warm for this freezer. So this is out of range as well. Congratulations, you've made it through all of my quizzes. If I were Oprah, I'd give you all a car. but since I work for state government, I have no money to disperse that or pay the taxes for a free car. So thank you all for participating. If you do have a temp out of range, there are, this is also in the vaccine management guide. You'd have to put do not use sign on the unit that is out of range. Thank you, Chris, for giving everyone a car, and notify the help desk. So we have some clinics that have a unit that goes out of range and they don't notify the help desk. So you're required to notify the help desk. They will take you through the process. They will send you a questionnaire asking about when it was out of range, for how long, why, and then they'll let you know if the vaccine is still usable. So you'll record that in the vaccine storage troubleshooting record. And we'll go into the vaccine and immunization information sheets, or the EUAs. In some instances, we still have EUAs. So those should be given before every vaccination. They need to be updated. Some of the best practices that we have here, there are more than these. However, using immunize.org, printing them off from the CDC website. There are some clinics that use their EHR to print them off. Make sure that if you are printing them off, you keep them in one place and not multiple places, because it's much more easy for you to forget that they're in multiple places and only update one stack. So how can we tell this VIS is up to date? We have on the other side the date on the bottom that you can check. Make sure that you have the VIS or IS for every vaccine that you have in stock. And how can you find out where there are multiple languages? Up here in the top right, immunize.org/VIS has them in multiple languages. When you go to that site, you can choose different languages to print them out in. So that was pretty straightforward. A lot of this stuff Nick has already covered, so I'll cover it briefly again. For eligibility coding or miscoding. So when the site visitor comes to your clinic, they're going to talk to you about eligibility categories. Make sure you know the eligibility categories. They'll want to know the billing practices, how much you're charging for the administration fee, and how many times you would bill for the administration fee, and then your documentation procedures. So staff must be able to screen all patients for the VFC eligibility, document that code, and then document that in alert. And Nick was talking about that with the 14 days to make sure those were in alert. And then I know we've repeated this multiple times, making sure you're reconciling your inventory in alert. And we see this quite often where alert doesn't match what's in your fridge or freezer. And Nick has put up the inventory, adjusting inventory chart. There's another link to that. So we've reviewed all of the codes. Not all clinics are going to be able to do the underinsured with the F code unless they are a federally qualified health center or a rural health clinic. Then they can use the F code. I'm not going to cover, Nick already covered all of these. So for the special projects, that was mostly with, we saw that a lot with COVID before it was commercialized, Genios before that was commercialized. We still have the special, we have the S code for summer flu. So this will pop up every once in a while, but not as often as the other codes. And then your borrowing logs. So this is something that frequently gets clinics in trouble, is that it has to be kept for 3 years. So they'll say we don't have a borrowing log, or we don't borrow. When I hear that we don't borrow, so we don't have a borrowing code, it's kind of a red flag for me to know that there might be something that they're not looking at. Make sure that it's available at the site visit, so they'll ask to see it, and then it needs to be filled out for each borrow. So a lot of times for the public clinics, we usually see a borrowing log with 3 or 4 borrows, not very many. So it's not very common for your clinics to have a ton of borrows. 1 or 2 usually, but not as much as the private clinics. And so really a best practice, and this for different reasons for private clinics versus public clinics, is taking that ad hoc report and reviewing an alert. We recommend to at least do it on a monthly basis. Some of the larger clinics, we recommend that they do that more often, because public sites don't usually have a lot of borrows, or if any borrows. It's a good way to catch what alert says is a borrow or is a coding error, or to see where there's an issue, especially if you get a lot of nulls. So a null means that it didn't subtract from your from alert inventory, or you'll get no codes. So I've been seeing that more recently, is that when I review borrowing logs, and when I review a borrowing log, I'll look at the ad hoc report and see, like Nick said, can I figure out where the vaccine went? And sometimes, and a lot more frequently, I see no eligibility code, or they'll have a lot of nulls, because either the clinic has staff that are using the vaccine it's typically staff is using the vaccine before it's entered into alert. I won't get into some of the other reasons, but those are the big reasons that I see. So this is the first page of the borrowing log, and you don't have to use this borrowing log. It's a printed borrowing log. What you can do is keep it, you can have a digital borrowing log. Just make sure that you're using all the required information that is on this log. So you would need the vaccine, patient name or ID, date of birth, stock borrowed. It does say lot number is optional. I find it helpful when I'm trying to track something down, because sometimes I can't read somebody's writing, and usually it can match up the lot number pretty well. Date borrowed, reason borrowed, and date paid back. So the reason borrowed is on the bottom of this chart. So make sure if you are putting in a borrow that you're using the correct number. So at the top is borrowing VFC vaccine. At the bottom are numbers for borrowing private vaccine. So after you've made it through the site visit, congratulations. Hopefully it wasn't too stressful. The site visitor will review the findings with you, and then they will send an email with the findings called a corrective action plan. And attached to that will be a acknowledgement of receipt that you'll have to sign and send back. That's required. Even if you have no findings, they'll send you an email that says that there were no findings. So that's something that we keep and is required for us to have. Here's a question on the ad hoc report. Can we use the ad hoc report and filter out all that are not borrowed? Yes. So that's, and Nick pointed out, it's when you're able to, and if you need help figuring out how to do the ad hoc report, please reach out to me. Nick and I have done multiple trainings helping people figure out how to do the ad hoc report. It can be difficult. But once you get your ad hoc report, start messing around with it and filtering you filter out those that are not borrowed. So under the borrowed, if you click the little filter, once you add filters, you can unclick no, and then you'll just get yes. So usually for that column, you'll get yes, no, and null. Null means alert doesn't know, has no idea if this is a borrower or not, because it doesn't have the right information. And then once you see that there is a true borrow, and you don't, then you would write that in your borrowing log. You would still either physically write it in your borrowing log, or you can type it in a spreadsheet if you wanted to. The vaccine management guide is on OHA's website. I'd have to put the link in. And the eligibility codes are so in the vaccine management guide, it has the public chart for eligibility codes, and it has the private chart. So you would only review what you would need. The ad hoc report is one of the greatest tools. And then to really do a deep dive into lot numbers, you can use the ad hoc report against the transaction report that Nick was talking about to really kind of get a good idea of what's going on if there's some errors. So those two reports are your friend when you're trying to figure out what's going wrong, if something's going wrong. There's always something going wrong. Oops. They will, if you have any questions about the email the site visitors have sent or anything that the site visitors talking to you about, email them back or call them on the phone for clarification. They are more than happy to do so. Once the follow-up is complete, they will let you know that the site visit has been closed, and you'll, in the next 1.5 to 2 years, you'll have another site visit. So I thought it would be a good idea to show something funny at the end of this long day. I don't know if anyone's familiar with the Ig Nobel Awards. So those just happened for this year. It's put on by MIT. And it's kind of the humorous version. They take actual scientific papers and they give out awards like the Nobel Prize, but it's called the Ig Nobel Prize. And people do dress up. It is funny to go and read the newspaper articles on those. So for this year, Swiss and German and Belgian group won for demonstrating that fake medicine that causes painful side effects can be more effective in patients than fake medicine that does not cause painful side effects. So that's an interesting take on the placebo effect. I'd rather not take a medicine that causes painful side effects and isn't very helpful. And I thought I added the biology award because I thought this was, I'm not quite sure where they got this idea from, but they wanted to see if a cow that was terrified would produce less milk than a cow that wasn't. And so they put a cat on top of the cow and exploded a paper bag every 10 seconds for 2 minutes. Later deciding that the cat was unnecessary, which I find hilarious. And yes, the cow that was terrified did produce less milk. Here is the help desk contact information and my own contact information. Feel free to reach out for me for any questions. If you are having trouble with the ad hoc report or can't figure something out, I would be more than happy to discuss those with you. And then these are some of the references and links I have. So thank you.